Hey everyone, and/or welcome back. So we're going to talk about jaundice really quickly and why so many parents are afraid of the term when they hear us say it in the hospital setting usually. So what is jaundice? Jaundice is an increase in bilirubin in the system. So we all have some degree of bilirubin. The next time you as an adult go to the doctor and have your blood drawn, you can ask your doctor just for curiosity's sake, what your bilirubin level is. And most likely as an adult, unless you're in liver failure, your bilirubin should be like a 0 point something or maybe a 1 at the most. With newborns, obviously, their organs are not as mature as ours, so they have a harder time getting it out. Like I said, it's processed through the liver, so those immature livers can't really process at a high level of bilirubin. So it's said to say something like 60% of newborns develop jaundice. So that is to say that it is very normal and very common, and it's not really as big of a deal as you may be led to believe in the beginning until you're actually explained to thoroughly what it is. So it's an increase in bilirubin in the system. It makes the skin look yellow, or the white part of the eye starts to look yellow. You may notice that your baby gets really fussy during this time, just because it is a toxin, so it is irritating to the gut. It comes out through peeing and pooping, so obviously, it's a toxin in that digestive tract that's irritating to the baby. So they tend to get somewhat fussy during that time, and you might notice that their poop will change. So it'll become extremely foul smelling. It may change in color and or consistency. Different formulas, different milk makeups may cause the poop to look and smell a certain way, and when the bilirubin interacts with that, then that's usually when it gets super smelly and stinky. And then they will poop in excess to try to get that out of their system. So what happens is the hours of life your baby is determines the higher number of bilirubin they're allowed to tolerate in their system. So on the first 24 hours, you may hear us say, oh, your baby has a bilirubin of a 5 or a 6, and that's pretty high. We may want to intervene and do some things. Versus 5 days later, when your baby's 5 days old and they have the same number, you may see staff not be as concerned. And that's because baby's older at that point, so it doesn't affect them the same way. Now, the reason we do want to intervene as early as possible is because, like I said, it's a toxin and it can travel to the brain and it can cause brain damage. So we don't want that to happen. We want to catch it before it ever gets to that level. So it has a lot of risk factors involved. So if your baby is extremely premature, if mom maybe had a car accident or fell during her pregnancy, if baby has something like a cleft palate or maybe Down syndrome that affects their ability to eat very well, all of these things are risk factors that would cause baby's bilirubin to be increased. So for those babies, we step in a little bit earlier than the full-term, completely healthy baby that's been eating, peeing, and pooping on a regular schedule. So it doesn't necessarily mean that you did anything wrong. It just means that some babies have a higher risk than others. Also, mom and baby's blood compatibility. So if you hear something called incompatibility blood type or DAT or Coombs, kind of like a comb for your hair with an extra O in there. If the baby comes out to be Coombs positive, those are also other risk factors that would cause baby to become jaundiced very easily and very early on. So If you notice that baby is looking extra yellow, then you might want to consider taking baby to the doctor if you've already been discharged and get a bilirubin check. Hope you learned something. Hope this helps, because that always lets me know I've done my job. See you next week.